Hi everyone, and welcome to this week's lecture. This week we're going to be talking about Applied Behavior Analysis, or ABA as it's typically called. ABA is an intervention strategy. It's a teaching strategy that's used typically with children who are on the autism spectrum. And the reason we're going to spend some time looking at it this week is because it's becoming very common and very widespread. If you spend any time working with children who are on the autism spectrum, the chances are really good that you're going to see ABA in action and that you're going to work with professionals who are trained in ABA. So in order to teach a child to use the intervention strategy of ABA, professionals are typically certified in this, so it's not something that you just do a little bit of reading about and then go use with children on your own. But despite that, it is something that I want you to be familiar with because it is so widespread. I want to give you a little bit of the background about it today, and I want to share a little bit of the terminology so that you're familiar with it when you run into it on your own. So first let's talk about what is ABA. Here's a definition that I'll share with you. ABA is a process of studying and modifying behavior that has been rigorously tested and is effective for many individuals with autism and other developmental disorders. It changes the environment and monitors changed responses from the person to result in changed behavior or learning of life skills. So there's a couple of things that I want to point out to you here. First of all, you're going to notice right away that we're talking about studying and modifying behavior. And think about the name of this intervention, right? Applied Behavior Analysis. This intervention is all about looking at the behavior that a child is demonstrating and intervening in that behavior, changing the behavior in some way. Typically, the behavior is changed by looking at the environment, changing the environment, seeing how changing the environment changes the child's behavior, monitoring that, responding to that, continuing the process, with the goal being to specifically result in changed behaviors that have been identified, that are a goal that they're working towards, or the learning of life skills in some way. Changing behavior is something that we talk about a lot with children, not just children on the autism spectrum, right? So children who are in an early childhood setting, we might be looking at their behavior. Sometimes early childhood professionals use something called an FBA, which is a functional behavior assessment. They look at why is a child demonstrating this challenging behavior and what do we need to change about the environment in order to address that. Behavior assessment is part of ABA, but ABA is even bigger than that. It's a really broad strategy that's used. So I mentioned on the previous slide that we're talking about behaviors. There's a theory of education called behaviorism, and ABA is a behaviorist approach. So ABA uses positive and negative reinforcement with the goal being to alter ways people behave. So the tools that are used are positive and negative reinforcement. ABA is based on B.F. Skinner's theory of behaviorism. So B.F. Skinner was a scientist, and he was interested in why people do what they do. So he was interested in looking at people's behavior, and he conducted a lot of experiments. The result of his experiments led him to the theory of behaviorism, in which he stated that people do things, they exhibit the behaviors they do when they are reinforced for them. Okay, so reinforcement results in behavior. Whether it's positive reinforcement or negative reinforcement, reinforcement changes the way that we behave. He did a lot of famous experiments. He didn't just study people, he did a lot with animals. He looked at that conditioning. Sometimes it's called behavioral conditioning, the theory. And if you train an animal to do something, there was a study he did with dogs. And if you train a dog so that every time he hears a can opener, he's going to get some food, the dog begins salivating every time he hears the can opener. And eventually, if you repeat that action enough times, the dog will salivate even when he doesn't get the food, because the can opener has taught him to salivate. So he looked at a lot of examples like that. Some people, disagree with behaviorism. They say that human beings are more complex than that. While in a lot of ways, yes, that's true, there's also a lot of truth to the fact that as human beings we respond to reinforcement, and that's what ABA really capitalizes on. Excuse me. Dr. Ivan Lovaas at UCLA developed ABA in the 1980s and the 1990s, building off B.F. Skinner's theory. Lovaas was a behavioral specialist. He worked with children with severe developmental and behavior disorders, including self-injurious behavior. So he was really interested in finding a way to change these children's behaviors because they were harming themselves. When he tested his theories of how to apply the theories of behaviorism to teaching children, he had very positive results. So what Dr. Lovaas and his kind of team did was they developed a curriculum and they developed a teaching method based on the idea of doing a few things. They wanted to use a clearly defined repeated trial, so an instance of teaching was called a trial, to teach a target skill. Okay, so one specific skill was isolated, one specific skill was targeted each time. They didn't try to do anything broad or, really dynamic. They wanted just to focus on one thing. And then they wanted to look at how many times do we have to practice this skill, whatever this skill is, over and over and over again before the child gains the skill. And each of these target skills was a small building block needed to move toward creating a normal repertoire of behaviors, right? So human beings, our behaviors are really, really complex, and it takes a lot to really think through every minute kind of action that is required for our whole set of behaviors. So what Dr. Lovaas said is that if you break down a complex behavior into enough small parts, you can teach each of those parts individually and build upon them so that the child moves towards a normal set of behaviors that is much more functional for the child. So that gives you some of the background on ABA. I'm going to spend the rest of our lecture today talking about something called discrete trial training. Discrete trial training is a part of ABA. So it's not just ABA itself. ABA is much bigger than discrete trial training. ABA involves all of that, looking at what's causing behavior, analyzing children's behavior, all of the different things that an ABA therapist would be trained in. Discrete trial training, though, a lot of times is what people will think of when they hear about ABA, because it's what's happening in the classroom a lot of times. It's the instructional part of ABA, and it's a method of training children that's consistent with the principles of ABA, thinking about that behaviorist approach. So DTT is an effective way to break down information so children with ASD can learn a skill. We know that children with ASD have a hard time understanding how to break things down on themselves. They don't learn things sort of automatically like a typically developing child does, so DTT breaks it down for them. DTT capitalizes on children's desires for immediate gratification. So we're going to talk a little bit more in a few minutes about reinforcement. DTT really emphasizes praising and rewarding children for exhibiting appropriate and desired skills. The kind of funny thing is that in the field of early childhood education today, we're normally a little averse to talking about rewards and positive reinforcement in the sense of creating, children's dependency on receiving a reward for acting right or for acting good. We don't want to encourage children to just be good for us because they're going to get a reward, right? We don't want them just to act right to earn that reward. One of the reasons that this isn't so applicable to children with ASD, remember we've talked in earlier weeks, is that children with ASD don't develop internal motivation in the same way that typically developing children do. So they need help developing that motivation. That's not to say that they don't feel a sense of joy or pride when they do something that is rewarding for them, but it is to say that they might need a little bit more help along the way to learn those appropriate behaviors or those necessary academic skills that we want them to learn. So what we're going to do is we're going to use an intervention like DTT to help them to develop that motivation, to do it externally because they can't do it internally on their own. Here are some of the terms related to DTT that you might hear that I just want you to be familiar with. Chaining. Chaining is when the skill to be learned is broken down into the smallest possible actions or steps to facilitate learning. So we want to, look at a skill if we want a child to learn how to wash his hands before or after toileting, let's say. We really think through each possible step in that action, from moving the step stool, stepping up onto the step stool, turning on the water, wetting hands, using soap. And this can be applied to any type of skill or behavior that we want a child to learn. It can be applied to academic skills, like being able to sound out words. Before we can ask a child to sound out words, we have to be able to make sure they can say all the sounds. Before they can say all the sounds, we have to be able to make sure that they can move their mouth appropriately to say the sounds. So chaining is looking at all of the very small steps along the way to learn a larger skill. Prompting. Prompting is part of DTT because when the child is being encouraged to learn this new skill, the parent or the therapist is going to provide the assistance, they're going to provide the encouragement that's needed to get the desired response from the child. So the term that's used in DTT is the stimulus is given. So whatever the stimulus is, maybe it's a command, do this, do that, point to this, point to that, say this, say that. And if the child doesn't do it on his or her own immediately, some kind of prompting is going to be used. The least intrusive prompt is going to be chosen to encourage the child to be independent as possible. Prompts might include a verbal cue, right? So they might just repeat the stimulus first. If they said do this, the child doesn't do it, they might say do it again, do this. There might be a visual cue that's given, so some kind of flashcard might be used, or the therapist might point to something to remind the child. Physical guidance could be used, so if the child isn't doing it on his or her own, the child's going to be guided to do it. Turn on the water, and the child just stands there. Turn on the water, the child just stands there. The therapist might take the child's hand and use it. Do hand over hand. And if none of those are successful, the therapist might simply demonstrate again for the child what the appropriate behavior is that's expected so that they can continue to learn what it is that's being expected. Fading is another term that you might hear. We're thinking about the prompts here. So fading, we want children to not need the prompts at all. Prompts are going to be gradually faded out to make way for new behaviors to be learned. Again, we're striving towards independence here with these skills. Shaping. So kind of some of these examples that I've been given so far, we've been talking about learning a new skill, right? Teaching a child how to wash his hands, teaching a child how to sound out a word on a paper. Shaping is a little bit different. Shaping occurs if there's an undesired behavior that already exists. A therapist might suggest trying shaping. So shaping is when we gradually change an existing behavior that a child is demonstrating into a desired behavior. Shaping is very time consuming. If you have a child in your classroom who likes to throw crayons across the room, every time he walks by the art center, he picks up a crayon and throws it across the room. What's going to be required is a teacher being available, that every time the child walks past the art center and sees a crayon, gets ready to pick it up, the teacher's hand is placed over the child's hand. The teacher says, crayons are for coloring, helps the child to make a line on the paper, and then helps the child walk away from the art center. And that would be needed every single time that the child walks by the art center. So shaping can be a really time-consuming process, but it's necessary if we need to eliminate an undesired behavior. Reinforcement. So we already talked a little bit about this. Reinforcement is a big part of DTT. It's typically called differential reinforcement for a couple of reasons. The amount of reinforcement given is going to be different depending on how difficult the skill is for the child, or how new the skill is, if it's a skill the child's been practicing for a little while, or if it's brand new. We need to remember also that the reinforcement that's going to be given it has to be tailored to the child. So you have to know the child. Children with ASD, we've talked about some of their sensory differences. We've talked about interest differences. You have to know what motivates a child, and you have to know what they like. If a child doesn't like touch, a hug isn't going to be a very good reinforcer. But if a child really enjoys firm touch, then a hug might be a great reinforcer. And there are all kinds of reinforcers that are used. Negative reinforcement is not typically used with DTT. It might be, there might be a no given, or some other type of negative reinforcement to show that that's not the right choice or action. But typically we're talking about positive reinforcement. It's an incentive given immediately after the desired behavior to encourage that behavior. It could be as simple as verbal praise. Could be a favorite activity, free time. Sometimes in DTT, food is used for children, especially if it's really motivating. Some therapists prefer to try to stay away from it. Privileges like a special job in the classroom, or some kind of token that the child can accumulate to earn a prize. So all of these are possible reinforcers. And the last term that you should know is generalization. So generalization is an important part of ABA because if a child doesn't learn to generalize the skill, he's not going to be able to apply it to his everyday life. And that's why once the skill is taught in the classroom setting or at a table setting, it's then taught in more general settings, including the natural environment. And in order for it to be beneficial to the child really does have to be able to generalize it. So that's ABA and DTT.